Dr. Anshul, and thank you all. And now we are moving towards the English session, and I request Dr. Dhanesh to take over the charge.
Thank you, Sahani sir.
Yeah.
Good evening, good afternoon, and good morning. This is the 1773rd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Srikant Talari. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again, and you can subscribe the same without paying any money. You can share it with your friends, whether it be a homeopathic lover or a homeopathic student or a doctor, it doesn't matter. The purpose of this forum is to take homeopathy to every home around the world. And let me come to today's guest. As you all know, today our guest is Dr. Srikant Talari, a consultant physician at Cancer Care Clinic, Prana, Pune. And he has been practicing homeopathy since last 15 years and started the charitable OPD at Lanova, where he has been practicing a lot of acute cases. He started his private practice simultaneously in 2008. At present, he is responsible for Cancer Care Clinic at Prana. And the Prana is conducting a lot of seminars of Dr. Shankaran, Dr. Saigal, Dr. Mohandi, and Dr. Sapta Rishi, etc. At present, the Prana's academic wing is collaborated with TDS, and that is the other song. He is in charge of the academy. And Dr. Talari he has written 2 books, The Art and Skill of Case Taking, a Practical Integration, and the second one is Tool by Srikant Talari. He has conducted international seminars around the world, particularly in UK, Australia, Canada, and Western. He has been taking a regular class at Western College of Homeopathy in Canada. He is a regular faculty at the Other Strong International Academy. He regular webinars of the same on the national as well as international session, and he is a person.
Talari, आप ज्वाइन कर लीजिए, आपका इंग्लिश सेशन चालू हो गया है.
Who is taking lot of
progress. आपका इंट्रोडक्शन चल रहा है जी, जल्दी ज्वाइन कर लीजिए.
In national level as well as seminars in Maharashtra, then other part of India, lot of at different medical colleges in India. And he is a person who is dedicated his service to research also. COVID research, actively participate in research at KEM, Ribai Hall Clinic, Pune. Research was a role of homeopathy in COVID cases. Presently doing research on granular matter mastitis in both these researchers. And today, Doctor will be talking about some difficult cases from his practice. And as you all know, the International Forum is conducting all these webinars free of cost. So we are really struggling to get money to conduct these sessions. So hope all of you will contribute your contribution for IFBS so that we can manage our day-to-day business without any difficulty. Hope all of you will really help us in that way also, because we are getting in national as well as international faculties here. We would like to present more people, and we would like to contact some of the seminars, physical seminars also in India in collaboration, in connection with our 2000-day celebration, as well as 5th year anniversary, etc. Anyway, our guest has joined now. And sir, I have already introduced yourself to this forum. Hope you are here, and we proudly welcome once again Dr. Srikant Talari. Yes, sir.
Thank you, sir. Thank you for the nice introduction. And as we have discussed today, our topic is cases. Basically, I have presented many times on this platform, so I feel now it's better to just share cases from daily practice, and through those cases we can learn. Yeah. So let me share with all of you one case that I saw very recently. This is a case of a man who came to me with uh, symptoms of uh, joint pains. So this is a male patient, and his age is around 45 years. 45 years old, male patient, and he has mainly joint pains, and he feels it is because of his uric acid is high. He has this joint pains since the last uh, 2 months, but he has had such kind of similar joint pains and gas issues 3 years back, while he says that this gas issue has always been there since the last 20 years. Okay. So see, now my first observation is this, that patient's presenting complaint is joint pains. No, that all of my joints are paining, it is very painful, I am having difficulty in walking, I have morning stiffness, these kind of symptoms patient had. But what I'm looking at and what I observe is that there is a concomitant symptom in the form of gas. No, there is GI symptoms, concomitant GI symptoms are there, which don't seem to be having a direct relationship with the joint pain itself. But this gas, this flatulence, uh, is there since 20 years. So what you can sort of analyze from this is that most probably the same gas complaint has slowly progressed and increased to start causing joint pains. So I know the most characteristic symptoms will be found in the gas trouble rather than in the joint pains, because the joint pain and gas are connected, and the gas is the older symptom. The older the symptom, the more original unmodified picture of the disease you will get. The more original, the more unmodified the picture of the disease before any medicine is taken, the better characteristics you will get. Therefore, I asked him, okay, I understood your joint pains. Can you explain this gas problem? How it began, why it began, so on and so forth. So he says that this gas problem, doctor, I also don't know why it started or how it started, but I feel it could be because he's a truck driver. So I feel it could be because I used to drive vehicle for long hours, and I used to not sleep properly. I used to eat gutka regularly. I used to occasionally drink alcohol, all of this. So I think maybe all of this together cause the gas problem. So I said, out of all this, what you feel could be the most bothering one? Loss of sleep, or excessive exertion, or alcohol, or gutka, etc. So he says, doctor, actually I feel all of this may not be the real thing. I said, why? He says, you see, um, since the last 2 years I have stopped driving. I have my own truck, I am sending other people, and now I don't eat gutka, I don't drink alcohol, I sleep very well. So if these were the causes, then now the gas problem should not have been there. But now why is it there? That means there is something else that is the reason. So I said, what do you think, what is the reason? So he said, see doctor, actually uh, early morning every day, no, when I wake up, I wake up with stress. I said, what is the stress? No, this stress is there that, will I get money? Will I earn money? Will I lose money? This people over here, who are sort of giving me this truckload. They are selling me, go and deliver there, and then I have to pay them advance money. So I'm very tensed. What if the opposite party does not give money? What if I lose money? What will happen to me? So I'm very scared about all these financial stresses. And then because I think a lot, no, then I start feeling weak. And what happens? I start losing grip. I feel like I will fall down. I feel like I will lose balance. And then at that time, I feel I want to eat something. And if I eat something, and if I rest or sleep for an hour, then I feel better. I'm ameliorated by eating, resting, or sleeping. And this especially happens almost always around 12 noon. Around 12 noon only it will happen every time. It will not happen in the morning, it will not happen in the evening if I don't eat food on time. But if I don't eat my food at 12 around that time, then I will definitely get this symptom. Then I have to eat, and only if I eat I will feel better. And if I don't eat, then I will have trembling, then I will have perspiration, and then I will also have coldness. I feel my body is going cold. So this is one very important symptom I have. And at that time I feel like my stomach is distended and full, and that's why I call it as gas trouble. Then I ask, okay, now tell me, how is your present joint pains? So he says joint pains means whole body aches, but the most bothersome symptom is I have burning in soles, which is better by keeping feet in warm water with salt. So I put salt in warm water in a bucket, and then I keep my feet in that bucket, and then I feel better. Okay, so can anyone please share what do we see, what is important over here from this much of information? Anyone, can you please suggest? So Dr. Ram has said that it could be anger suppressed. Okay, it could be Nakswamika. Okay, anger suppressed. Why anger suppressed? Patient has said that his stress is mainly because of fear of finances, fear of losing money, that I will pay someone and what if they don't pay me back. Okay, so the first thing I see is the stress is about losing money, okay. Second thing, because of this stress, what is happening to the patient is mainly patient is becoming weak, and there is a characteristic to this weakness. This weakness is not coming any time of the day, it's not constant. There is a specific time modality to it, that is 12 noon. And then along with it there are other symptoms like coldness, perspiration, etc. And then in the present complaint also you have burning ameliorated by warm application. I think by now the remedy should be very clear to all of you. Can anyone guess? Arsenic album. Yes. Why arsenic? Because always remember, fear of losing money, fear of losing property, topmost remedy is arsenic. And then once you see that, and then you see midnight aggravation. Midday aggravation is what? Arsenic. No? And then the patient's main complaint is what? Weakness. Weak is arsenic. Weakness, prostration is arsenic. This fear of financial loss causes weakness, prostration, which is better by eating, and there is especially midday aggravation. Midnight aggravation is also arsenic. And this is the characteristic symptom of arsenic, burning better by warm application. Burning generally should be better by cold application, but the characteristic of arsenic is it is better by warm application. Heat, burning, generally you expect that cold will ameliorate, but the characteristic of arsenic is warmth will ameliorate. Okay, so from this case what I wanted to show is how, with the help of taking the history and going back to the original unmodified picture, original unmodified disease, we will get keynote symptoms. If I just stayed with joint pains, I would have had only burning in feet, better by warmth. Sometimes you prescribe on this one keynote, you may get result, but having the whole picture which connects the old symptom and the present symptom, that is what will give you confidence in your prescription. That is what will tell you that you should stay with this remedy, you should not change this remedy, because both the symptoms are covered by your remedy. Okay, now let's see another case. This is a case of cancer. Okay, this is a case of a again 50 year old female, and she presented with the complaints of neuroendocrine tumor. She has neuroendocrine tumor. Okay, so, and this tumor, neuroendocrine tumor, means tumor of the nerve and endocrine system. Generally neuroendocrine tumors are observed in the liver. Okay, liver mets are generally seen. This is the most common presentation of neuroendocrine tumor. But what was strange is this patient told me that she has a tumor in the pancreas. I said, you have tumor in pancreas? He said, yes. So I said, one more thing very common is in neuroendocrine tumor, because as I said, the tumor is either in the liver or in the pancreas. It is very common that you will see patient will have GIT symptoms. So either they will say I have lot of vomiting or diarrhea, huh? Diarrhea or indigestion or gases. This is the main presenting symptom of neuroendocrine tumors. Okay. So I said, okay, tell me what symptoms you have. So she says, I have only one symptom, that is hot flushes. I said, what, hot flushes? She said, yes, hot flushes. And this hot flushes, they have not been reducing since a long time. So initially they thought that it is because of menopause. I am 45 years old when I was this, my menses stopped. But it's 5 years now, menses have stopped. Still I am having hot flushes. So the doctors feel that there is something else that could be the reason. So they started investigating. And when they investigated, they found out that I have a tumor in the pancreas. They investigated that tumor further, and then they found out that this is a neuroendocrine tumor. So other than that, actually I have no other symptoms. Now this is very strange. See, I'll tell you one thing. Generally, there is one big question that many homeopaths ask. They say that, uh, if I see a case of cancer, should I look for the rubric of cancer? Should I look for, so for example, this is a case of neuroendocrine tumor. Why not look for remedy which is known for pancreatic cancer or which is known for endocrine tumor? Remedy should have pancreatic cancer. Remedy should have neuroendocrine tumor. Why should I not give a mother tincture for the neuroendocrine tumor? Why should I not give some remedy to, reduce the size of the tumor? Why should I always take history and find symptom and characteristic symptom? Why all of this? Why not just give a remedy which matches the pathology? And especially when patient has such big pathology, then though we should take, this is a very common question. So I will tell you one thing, you should take a pathological rubric or give a pathological remedy when the patient is presenting with pathological symptoms. The underlining factor is pathological symptoms. What do I mean by this is, this patient is presenting with pancreatic cancer or neuroendocrine cancer. If the patient has neuroendocrine cancer and the patient has nausea, vomiting, diarrhea, these are pathological symptoms of neuroendocrine tumor. If the patient has pancreatic cancer, then patient will have symptoms like pain in epigastric region extending to back, vomiting on eating, intolerance to eating, aggravation of pain after eating. These are common symptoms of pancreatic cancer. Now what is interesting is our patient neither has nausea, vomiting nor has pain, epigastrium, which are signifying either this is a classical neuroendocrine tumor symptoms or this is pancreatic cancer symptom. So that is when you should start thinking that this pathology is just an accidental finding. This pathology is just an accidental finding. The actual disease is somewhere else. Therefore, Hahnemann is telling repeatedly, look for symptom similarity. Symptom will tell you where to go, what is to be treated. Now, what is important is this patient is presenting with hot flushes. Hot flushes is a symptom which is related to hormonal changes, which is related to menstruation, which is related to menopause. What is that symptom doing here when the patient has pathology or like neuroendocrine tumor? This itself should tell you that this pathology is not important, this symptom is important. So I go behind the symptom rather than pathology. So I ask the patient, talk about this hot flushes. So she says, yeah, this I have since 5 years. I said, how it began 5 years back, why it began? So she says, it is common symptom, no, menopause. So I said, no, there must be other reasons. why you started developing this symptom, because it has not resolved. There must be something else. So she says, yeah, emotional problems can be a cause. I said, yes, they can be. So she says, yes, I was going through a lot of emotional problems. What was the emotional problem? I ask her. So she says that, doctor, my father was dying at that time. He had some disease and he was in his last stage. So my desire was to spend some time with him, be with him, serve him, exchange my feelings, express my feelings, all of that. But you know what? My stepmother, actually, my father married someone else after our mother died. So my stepmother sort of did not allow any of us to come near him. She kept all of us sort of at a distance. So that caused a lot of problem for me. I had a lot of grief that my father is dying and I'm not even able to talk with him. I'm not even able to express my feeling. So all those feelings that I had just remained inside. I could not talk with him. I could not express. All those feelings just remained suppressed inside me. And then my father died after a few days. So all those feelings are still there inside me, which I have never spoken of, which I have never been able to express. And that grief is still there, and that is what is causing all these complaints. Okay, I think again remedy should be very clear. Anybody, can you tell me which remedy? Anyone? Which remedy? Any suggestions? Okay, so what we see is patient has ailments from grief. No, grief of losing loved ones. But what is important is, from this grief, the main feeling the patient has is, I have feelings which are suppressed in me. Feelings which are suppressed in me, feelings which are inside me, feelings which I could not express, and they have remained within me. Anybody, which is this remedy? Ailments from grief with suppressed feeling. Remedy is nitrum mure. Okay, nitrum mure has suppression. No, we learn, no, in materia medica, suppressed grief, suppressed sadness. That is what is nitrum mure. Now ignitia also, some of you have said. So ignitia also has suppressed grief, suppressed sadness. So what is the difference between ignitia, nitrum mure, and another topmost remedy for grief is phosphoric acid? These are the top 3 remedies that we should always think of for grief, for ailments from grief, right? So the first remedy that we should differentiate is ignitia. Okay, in ignitia, what is the grief? Grief is shocking or sudden unexpected loss. So in ignitia also you have grief from losing a relative, but the important point in ignitia is it is a sudden unexpected loss. Suddenly I lost my husband in a road traffic accident. Sudden, unexpected. It was shocking. He died. Suddenly he was sitting here, he was having dinner, he went to sleep and he did not wake up in the morning. So this sudden unexpected loss, sudden unexpected death, that is what causes grief in ignitia. Ignatia's grief is from sudden unexpected loss. It is not just loss, but the suddenness with which they lost, but the unexpected manner in which they lost the relative, that causes grief, and that causes and that's why the symptom of ignitia is globus hystericus. They will say I could not cry. Stuck. It's stuck. I cannot swallow, I cannot weep, I cannot do anything. Or that it was so sudden, it was so unexpected that everything is inside and it has called spasm, and I have difficult swallowing, I have globus hystericus, or I have involuntary sighing. I feel I am not able to take breath fully since then. This is very important symptom of ignitia. That is involuntary sighing. Cannot take breath since then. Nitrum mure, we already saw. We see this, suppressed. In nitrum mure, the concern is I have unexpressed grief inside me, which I can share with that one person only. That only my father I could have told. Now father is gone. There is no point in telling it to anyone. I could have spoken this only with my father. Only that one person is important. That one person is very important in nitrum mure. That one person with which I could have expressed this, that person itself is gone. Now who to express? It will always remain inside me, always suppressed in me, never to be expressed. This complete suppression and this feeling that I can never ever express it, never ever tell it to anyone else, that is what is nitrum mure. In ignitia it is shocking, it is unexpected. In nitrum mure it is unexpressed, it is suppressed. The third remedy is phosphoric acid. In phosphoric acid, the feeling is I sort of loved this person and that person is gone, and now I feel that what is the use to live? There is nothing that really interests me, nothing that really enthusiasms me. I'm not interested in anything now. What is there to live? Now father is only gone. So what should I live for and what for? I have no interest. I am not excited by anything. Either this food or roaming or traveling or talking to people. I just want to be alone. I just want to be sad and grieving. This loss of interest in life, that is most important expression of phosphoric acid. डॉक्टर जब से वो चले गए तब से कोई इंटरेस्ट ही नहीं, तब से किसी चीज में मन नहीं लगता. दैट इज फॉस्फोरिक एसिड. नाउ आई हैव लॉस्ट इंटरेस्ट इन एवरीथिंग. नाउ आई हैव नो इंटरेस्ट इन एनीथिंग. दिस कंप्लीट लॉस ऑफ इंटरेस्ट इन थिंग्स, दैट इज फॉस्फोरिक एसिड. So this patient I gave nitrum mure. Okay. So now let's move on to case number 3. Okay. So another case is a case of just 1 minute. Let me revise it before I start. Okay. Another case is again this is a case of cancer lung. This patient has cancer of left lung. Okay. She came to me because she had widespread cancer and she is having severe pain in abdomen with cramps. she's having cramps in the abdomen, severe pain, which is better by bending double and warm application. I am sure some of you already have remedies in your mind, but what is also important is, she said, I have loss of appetite, I have no desire to eat, absolutely no desire to eat, and I am losing weight very fast. Daily I am losing weight. See, loss of appetite, losing weight means patient is fast moving towards death. If you want to save this patient more than the severe pain, what you should try and do is increase the appetite. So increasing the appetite of this patient and making the patient gain weight, that is most important and the most difficult thing to do in this case. So and obviously you have to address the pain. The pain is a symptom which you should relieve, but the cure will be seen if you improve the appetite and loss of weight. So I ask her, talk about this loss of appetite. Okay. So she says, you know, doctor, always since my childhood, I have had very less appetite. Acha. I said, why? She's, so she says, doctor, the problem is, you know,
Very good session. And the cases shown were really excellent. And with the time for discussion, and those who want to participate in discussion may please raise your hand so that we can have a discussion and you can ask your questions also. Yes. Yes, Dr. Ramprakash, sir, you can. Sorry, sir. Again, once again, I can make you co-host. Due to some network problem, that's the reason why. Okay, sir.
yeah. Actually,
So
I have to complete one case.
okay, sir, you may complete, sir.
Yeah, I'll just complete that one case and then we can sort of start the. So what I was saying is that this patient said that since childhood her appetite has been on the lesser side and now it has become even more lesser. I asked why, what happened. So she said since childhood I had this impression of life that I am worthless and I am of no good, and I used to feel a lot of shame about myself. So for example, like, you know, people will say I have done my PhD. So it's a good thing, you know, people will be proud that they have done their PhD, etc. But I feel shame. Acha, I have done PhD. I will be embarrassed to talk about, I also have done PhD. I have PhD, because somewhere I have this feeling that, you know, people would not like me and that people would not love me and that I am of no value and I am of no worth. What if I have done PhD? Still, people will not like me for what I am. So I am always trying to please people. I am always trying to, you know, see what is the in the best interest of the other person rather than what do I like, what is my identity, what is my interest. That I am least interested in. I am always interested in what is the other person feeling, what does the other person want, how can I help them, how can I be nice to them, how can I share love, empathy, affection towards them so that they are happy. But same thing on myself, I will say no, no, how can you receive love, affection, empathy, sympathy, respect? No, no, you will not get anything. Nobody likes you, nobody loves you. This is how I felt all my life. Okay. So anybody, can you suggest what is the remedy that I must have given her? Kali carb carcinosin. One remedy could be carcinosin. Because she said that for that, because I wanted to be known, because I wanted to be good, I always wanted to have very good high grades in school. I was a perfectionist in my school. Okay, but actually more than perfection, what came up was this feeling that I am unloved, I am unwanted, that nobody likes me for who I am and how I am. So I never express myself. So we saw nitramure. In nitramure, what is there is I have particular feelings, but I could not express. Here I have feelings, but I don't want to express these feelings. I can express to someone, no, that I like this, I don't like this. So it's not like nitramure. If father is gone, then nobody else in the world can listen to it. These were feelings only for father. That is nitramure. In magnesium, what you see is this remedy. The remedy that I gave this patient is magnesium phos. Magphos, I think all of us know, has cramping pain, which is better by bending forward and warm application. But what is the Magphos mental picture? Magnesium phos mental picture is, in the magnesium element is that I have this kind of feelings, emotions, etc., but I don't want to express them. In nitramure, it was I could not express them, I wanted to express them. That is nitramure. Magnesium is I don't want to express them, I am suppressing them because I feel nobody will like. Who will like my story? No. Who will like me? No. Nobody will like me. This is magnesium, that nobody will like me, nobody will want me, everybody wants to see what is their interest. So I am always people pleaser. Magnesiums are people pleasers. I always think of other people, I always think how I can help them, I always think how I can uh, listen to them, how I can make them comfortable. That is magnesium. How to make others comfortable, how to make others happy. That is magnesium. And suppress your own feeling. Never express your own feeling. So much so that you have even forgotten what is your real feeling. That is repression. In magnesium is repression. Nitrum is suppression. Suppression is I wanted, but nobody allowed me to express. Magnesium is repression. I only killed my own feelings day in, day out, day in, day out, day in, day out. Don't express, don't express, don't express. So much I have not expressed that now I can't even remember my own feelings. What I like, what I don't like, what I wanted to talk, what I didn't want to talk, all that I've forgotten. I'm always about what other people like, what they want to do, that I want to do. That is magnesium. And phosphorus, because she talked about love, empathy, care, affection, love, empathy is phosphorus. But I think even with the physical symptoms, you could have come with to magnesium phos, because magphos has cramp. Colicky remedy, first remedy we think of is colocynth and magphos. No, but if you see repression and love, affection, then give magnesium phos. But at the same time, along with colic, better by bending double, if you see rebelliousness, anger, irritability, then you give colocynth. Colocynth has more anger, irritability against authority. Authority said this, I want to fight against them, I want to rebel, I want to fight, I am very angry, irritable, I get into arguments. That is colocynth. I am loving, affectionate, I want love, affection, I want relationship. That is magnesium phos. So this patient received the remedy magnesium phos. Okay, so today what I did from all these cases is I tried to show you subtle differences between these grief remedies, relationship remedies like ignitia, nitramure, magmure, all these are remedies which have to do with lot of relationships, affection, expression, love, sympathy, etc. And these are all themes of the row 3 of the periodic table. So in row 3 of periodic table, you have all these remedies. So let me show you. So this is the periodic. Where is it? Okay, here. This is the periodic table. So in row 3 you see nitrum, magnesium, alumina, silica, phosphorus. All these remedies are known for love, affection, relationships, bonding, expression, communication. This is what is the issue of this whole row. And that is where their issues are, that I am not being expressed or I am not being loved, care. I want all of this. That is what uh, is the theme of row 3. I hope all of you got a glimpse of it. I did my presentation pretty quickly. So yeah, that's what I had to share with all of you today. If you have any questions, please ask. I'm happy to answer.
Sir, you always rely on the same method Dr. Shankar sir has forwarded it to the world.
Yeah.
Have you ever compared the same with any other group study? I just like Saigav School of
Yeah, I think, sir, last time when I did the Hindi session, I showed all mind rubrics. So not always that I use the sensation method only. I definitely use the sensation method, but it's not like every case I will search that. First, you see the whole picture. You see the where the disease began, why it began, so on and so forth.
how will you manage acute cases in this respect, or in the shortest possible way? Or
So sir, the last case I talked about, patient was having severe abdominal pain. No, severe abdominal pain. So I obviously looked at the local peculiar characteristics, but also see if the same remedy is being seen in the mental level. So we are looking for characteristics for quick relief, but if you see that the mental picture also is matching with that particular remedy, then the action is much more faster, deeper, and more holistic.
exactly. Yes, Dr. Ramprasad sir, you can speak now.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. Srikant Talari. Sir. Very nice presentation. Every presentation is very nice and good. So very case presentation, excellent session, knowledgeable case presentation, and case is pathological and select remedy mental level.
Mental and physical, sir. Not
Physical,
only
mental,
mental
mental
and
and
physical.
physical.
Not only mental.
Very good selection remedy according to disease, according to symptom. Very thanks, Dr. Tilari sir. Thank you.
Now I invite Dr. Indrani Bhavatkar to say a few words, and you can ask the question also.
Yeah. Thank you for allowing me, Dr. Srikant. Good evening from Pune. We
Hello,
know
sir.
each other. I know.
Yes,
Yeah,
yes.
in Patna we have met. Good evening.
We know each other personally.
Yeah. Very true. Very true. Very nice of you. Actually, one small query that in cancer, WHO has declared that it is an incurable disease. Okay, we are managing homeopaths. That's a really great thing. But selecting a single remedy and giving single dose or multiple doses right from the selection, does it end the cancer case? Or you have to follow it for a long time? Can you guide on this?
Sir, it definitely depends on stage of the cancer, type of cancer, etc. So
Yeah.
in stage 4, definitely we are only looking at palliation.
Palliation. Hanuman mentioned it. Yeah.
So stage 4, we are looking at palliation only. But
Yes.
I think we are getting very, very unbelievable results if patients are taking exclusive homeopathy. And majority of my patients, I try to advocate that don't see, sir. Majority patients that come to us with cancer are those patients who have tried everything and then they come to us. So it's sort of easy also to convince them कि आप और कुछ मत लो, आप हमारा ट्रीटमेंट लो, आपको अच्छा लगेगा.
So that's assurance is important. Very true, sir.
हाँ.
Very true. Yeah.
तो
And
ऐसे
in stage 1,
लेकिन अगर स्टेज 1 स्टेज 2
हाँ,
आता है कि सर्जरी भी पॉसिबल है, कीमो भी पॉसिबल है, तो आई विल नॉट सजेस्ट कि आप बाकी कुछ मत करो, आप सिर्फ होम्योपैथी करो.
हाँ,
यहाँ पर
correct.
देयर आई सजेस्ट, हाँ आप वो भी लो, आप ये भी लो और आप करो. बट स्टेज 4 में तो डेफिनेटली मैं बोलता हूँ यू जस्ट टेक
That
होम्योपैथी,
is
फॉरगेट
that
एवरीथिंग.
is that is painless death they can achieve. That is very true. Very true. Correct.
And
Correct.
second, third category of cases are preventive cases. So I have done chemo, I have done surgery, but now a little bit of cancer is remaining here and there. I don't want to take more chemos for prevention. I don't want to take radiation for prevention, etc. There again, I tell patients don't take anything else, just take homeopathy. Your cancer will be prevented. You will not have relapse of cancer. So pre-cancerous condition, prevention of relapse of cancer, uh, like
Family history of cancer, we can say.
family
Yeah.
history of all that again we will treat exclusively. Only
Is
in
there any
stage
data available for prevention, like 100 cases, 200 cases, those are prevented? Do we have
नहीं
like this?
sir, अभी तक उतने केस नहीं हुए मेरे, and I have to work on creating data etc. Hopefully
कोई बात नहीं.
अभी तो पहले ठीक करने पे ही ध्यान है कि पहले
Okay.
patients तो ठीक हो जाए. Hopefully one day I will have lots of patients and also
Yeah.
the infrastructure, manpower to maintain data. So that is there in the background. As of now, I want to give good, consistent results, and then hopefully bigger things will happen.
Yes.
Thank you. Thank you for the explanation. Yeah. Yeah.
Yes, now it's the time to wind up the session. I am inviting Dr. Bob Lim to say a vote of thanks to the session. Dr. Bob.
Oh, I thought I want to sleep early. And thank you for calling me. My name, Dr. Naresh. You always remember me. Yeah, I think this has been a very interesting personal case taking. And Dr. Srikant has given us a very, very deep insight in how to manage difficult cases with homeopathy, and how to find the essence of the remedy to match with the symptom, and just taken pathological, emotional, and mental symptom all together. And it has been a very successful case, and I wish Dr. Srekan well, and I hope we can hear further sharing from him again in our coming webinar. And once again, thank you for this wonderful insight into management of difficult cases by Dr. Sri Khan. And on behalf of IFPH, once again, I will say thank you to you. Over to you, Dr. Danish.
Thank you, Bob. Thank you, everyone.
Thank you, Dr. Bob Lim, and thank you, Dr. Srikant Talari, and those who attend the session in this evening. Tomorrow we will have a session from Dr. Kanchan Pradi, and Dr. will be talking about homeopathic management of sleep disorders and associated conditions in children and adolescents. With that, we come to the end of the day 1773. It's over to Dr. Vishaila to moderate the Malayalam session. Thank you all.
താങ്ക് യു ഡോക്ടർ ധനേഷ്. എല്ലാവർക്കും നമസ്കാരം. ഇന്ന് IFPHന്റെ തുടർന്ന് വരുന്ന മലയാളം വെബിനാറിന്റെ 1773 ദിവസമാണ്. ഇന്നത്തെ മലയാളം സെഷനിൽ നമുക്ക് ഒരു പുസ്തക പരിചയമാണ്. പുസ്തക പരിചയം നടത്തുവാനായി എത്തുന്ന ഡോക്ടർ റിജി റഷീദാണ്. റിജി റഷീദ് PHMS, Reggie's ഹെൽത്ത് കെയർ സെന്റർ കാട്ടാക്കട തിരുവനന്തപുരം. ഡോക്ടർ റിജി നമുക്ക് പല ക്ലാസ്സുകളും ഇതിനകം നമുക്ക് എടുത്തിട്ടുണ്ട്. വ്യത്യസ്തമായ വിഷയങ്ങളിലായിരുന്നു നമുക്ക് ക്ലാസ്